that's all the sisters are all pointing at. All right, oh, my brother.
All right, I'm like, now let's pick that
partnerships are recognized for purposes of benefits, so that hospital visitation, for example, is something that is permitted, that Social Security benefits or pension benefits or others, that same-sex couples are recognized in all those circumstances. I think that we actually have an opportunity of passing a law that's been introduced in Congress right now, and my hope is this year we can get it done just for federal employees and federal workers. A lot of companies on their own, some of the best run companies have adopted these same practices. I think it's the right thing to do, and it makes sense for us to take a leadership role in ensuring that people are treated the same. Look, if you are, regardless of your personal opinions, the notion that somebody who's working really hard for 30 years can't take their death benefits and transfer them to the person that they love the most in the world and who has supported them all their lives, that just doesn't seem fair. It doesn't seem right. Okay, well, guys, listen everybody, I've got to take off. Anyway, I warned you guys I couldn't answer every question. Let me just say in closing, let me just say this in closing. Something that I talked about last night. You know, our constitute several trillion dollars, 1/6 of our economy. Even if you come up with a great plan that lowers premiums and creates greater competition and ensures freedom for you to choose your doctor and is bringing down the deficit, all of the things that I claimed, and prevents insurance companies from abusing customers. Even if we do all that, there's going to be somebody out there in a $2 trillion system who's unhappy with something, right? So they'll complain, well, I'm a medical device manufacturer. If you reform the system, that might force me to change how I sell my products. Or there's going to be a doctor who says, well, you know what, right now I get charged this way, and if you change how Medicare reimburses, then I might have to change my billing system. That's going to cost me a few $1,000s. I don't like that. The reason I'm pointing this out is if we're going to do big things on energy or healthcare or infrastructure, then we're going to have some differences. We've got to work them through. Nothing that human beings do will be perfect, but we shouldn't sort of assume that the other side is either heartless and doesn't care about sick people, or is some socialist communist who's trying to take over the healthcare system, or, we start getting into these caricatures of each other that are so damaging. And frankly, the political parties and the media haven't been helping, they've been making it worse. I want to dial some of that back. Let's start thinking of each other as Americans first, figuring out how we can help one another, figuring out how we can move this country forward. I'm confident we'll do great. Thank you, everybody.